Hello, my name is Jessica Moretta, and I am an acute care nurse practitioner student for Barry University. And we're going to talk about today how to repair wounds using the method of suturing. Um, Keep in mind that you don't have to suture all wounds, that you're able to use other methods of closing wounds, like using, for example, wound tape or tissue adhesive, such as steri strips or Exafin or Dermabond. But we're going to talk about suturing today. The suture that I'm going to be demonstrating for you today is a simple interrupted suture. Indications for suturing would be a laceration due to an accident or a surgical incision, a repair of a surgical incision. And keep in mind that not all wounds need to be closed. They can heal through the body's normal mechanisms, such as granulation and re-epithelialization. And some of the contraindications for suturing are time elapse since injury is important, delays in repair increase the risk of infection, location of wound and degree of contamination affect acceptable intervals between injury and repair. For the face and scalp, you could repair wounds a little over 24 hours. If you're going to be repairing extremities like arms and legs, and if they're very contaminated, you should close them up within 6 hours. Keep in mind that decisions need to be made on an individual basis. Intervals may be shortened in patients with impaired host defenses, and grossly contaminated wounds could be a contraindication for suturing. And most puncture wounds and bites, such as animal, like dog or cat bites, are not sutured, are not closed up due to the high risk of infection. And specialists should be consulted when you have substantial tissue loss, or when you have complicated facial or hand wounds, or injury to an underlying structure like an open fracture. And some of the equipment that I'm going to be using today for suturing the wound, which I have it all laid out for time purposes, we're going to be using a cleaning agent such as saline. You could have sterile gauze, a local anesthetic. I'm going to have my 1% Lido, a 5 to 10 ml syringe, a 25 to 30 gauge needle. The lidocaine that you could also use is a Lido with epi, but it is contraindicated in certain areas of the body, such as the penis or the nose or the earlobe. You would use the epi if you're going to be suturing and you need more time. You're also going to have inside the lac tray usually comes the needle holder, a pair of forceps, suture scissors, and then the suture material that I'm going to be using today is going to be a Proline 3O. Okay, we're ready to start the procedure. Now, before I start the procedure, I'm gonna have talked to my patient about, what I'm doing. I'm gonna be getting a consent, and then they're giving me consent. So then I'm gonna be going into the room, and I'm gonna be assessing the wound. I'm gonna be cleaning my wound. I could get the betadine and the saline. I'm gonna clean the wound well, and then after I clean the wound, I'm gonna grab my lidocaine. And I'm gonna grab my syringe with my 25 gauge needle, okay? And I'm gonna be numbing the area, and I'm gonna give it a little bit of time. And as I'm injecting the lidocaine, I'm going to inject in the corner, in between the layers of the dermis and the subcutaneous tissue, okay? And as I'm injecting the lidocaine, I'm gonna draw back and make sure that I'm not intravascularly inside, okay? And I'm not, so it's good. And then I'm gonna numb the area nicely, in the pattern, kind of like around the incision, okay? And make sure that it's nice and numb, and you just want to give them a few minutes. Okay, so when my patient it's numb already, and then I'm ready to come in, I have everything set up. I'm using regular gloves because just for teaching purposes, but after all of this, I would open up and put on my sterile gloves. My field is prepared, my patient is draped, okay? So then I'm gonna get ready to close my incision, okay? I have it all laid out for me here. I'm going to turn on the light so I can see. And before this, I'm going to put you always want to put your goggles on to make sure that nothing splashes to protect your eyes. Okay, and then you want to get your needle holder. Okay, you want to make sure that the incision is in this position in front of you. You want to make sure that the bed and everything is comfortable or where the patient's laying. Okay, so I'm just going to turn this a little bit to the side so you could see what I'm doing here. Okay, so when I go here, I'm going to start in the middle of my incision. Okay, and I am going to go down past the dermis layer, and you want good depth and good bites. Okay, you want to go down the dermis layer, passing the subcutaneous tissue. Okay, and then not too deep, but you want to get this good right here. Okay. Okay, and then you want to just pull up. Okay, and then you want to leave a little bit of the pigtail there. And then before you cross over, you want to close the middle. So you're going to do a surgeon's double loop, which is this way. Wait. And then you just want to grab the edge of the pigtail and cross it over. Okay, and then you're gonna just tie this one loop, okay, and then you could always secure with one more, but see, the second one is just one loop. Okay, you want to be careful you don't want to stick yourself. Okay, and then the knot, you don't want to leave it in the middle. You want to turn it to the side. And then right here, you'll grab your suture scissors and you'll just cut and leave about 1 centimeter. Okay. And then you want to keep on going. And we're going to try now putting it on the other side. I'm just going to be doing 3 little sutures just for timing purposes. You want to make sure that this incision, you want to make sure that the incision is well approximated and that it does not dehiss. Okay, make sure your patient's doing okay. Okay. And you want to put your needle over here. And then again, the double surgeon's loop. And you'll cross it. And then here you just go once. Okay. And that's my second suture. And then we'll just do one more for timing. And at this time you could talk to the patient, make sure they're not feeling any pain, which I don't think they are. Then I'm going to go in at a 90-degree angle. Now once you start doing it, you could just kind of go all the way through. Okay. And you'll put down the needle. And you're going to do your surgeon's loop. There you go. And then you'll do it one more time. You want to do this about 2 to 3 times, preferably 3. Okay, and make sure that it's nice and approximated. And this time, I'm just going to cut it here so you could see. And there we go. Now you see I could do 2 more here, okay, and it'll be nice and approximated. Okay, so when I'm done with my sutures, now you just, if there's any blood or anything, you want to clean it up, make sure it's nice, dry, and clean. Okay, you could talk to the patient about what they need to do for wound care. If they're in an ambulatory setting, you could have them come back in 2 days, keep it covered. They could come back in about 24 to 48 hours. Make sure it's just dry and clean. You could tell them about any signs of infection, any fever, chills, if the wound starts, you know, if it gets red, it feels warm to touch, you know, they might want to contact us, you know, after, if something like that would happen. If they're not covered, if they don't have their tetanus up to date, between the 5 or 10 years, you could cover them with a Tdap injection. And before you close the wound off, you could also apply a little mupirocin or a little bacitracin. It's not necessary, it's just, you know, your choice. If you want to cover the patient also with some oral antibiotics, you could give them a little cephalexin or a little sulfa, a little Bactrim. You know, and then that's it. And after that, you could just apply Alevin dressing or a non-herent dressing, and that's it. I think that's what we did today, and I think that I hope you enjoyed my video. That's it.